So if rates were to rise for a disease,
What was that?
if rates were to rise for a disease, is there any procedures you would take?
Yes, we always have policies and procedures, and our outbreak and cluster investigation would be initiated. What that means is that we would compile a list of any patients that have this organism, and then we would do a historical search to see if any patients have had it in the past and maybe we missed it, or just to see if this is truly different for us, because maybe 10 patients had it in the past week and we didn't realize that this is normal for us, but now it's 15. So we start with producing a line list of keeping track of all the patients. Then we do a historical search. Then we do a literature search. Our daily life for all the infection preventionists, usually what we do is we come in, we look at census. Census is a listing of every patient that comes into the hospital and their diagnosis. So it'll alert you to what they're coming in for, like abdominal pain, chest pain, that's a diagnosis. But sometimes you can get other pieces of information through a diagnosis. For example, fever, right? So we'll look at patients with fever because fever is an indication of an infection. The other way we also look at to see who we need to pay attention to during the day is not only the census information but also lab results. So
what other traits do you have to have for
this position?
Yeah.
I think that there's the educational component, right? But aside from the educational component, organization, you have to be strategic. You have to know systems. You have to be detail oriented. You have to have an analytical background to be able to analyze information and to just have a very a lot of awareness, because you're playing detective work all the time, right?